Good morning. So we're here today for a big agenda. And as Sandy introduced the roundtable this morning and spoke about the vision of the roundtable, spoke about its intention and focus on addressing and bringing a healthful and productive society forward with a focus on human capital. But she also mentioned in that vision statement that this would be dependent on resources and brought us back to the early comments from David Kindig. And Bobby just reminded us again about the focus on resources. And the shift, this is the long arc of change that we're talking about, but the shift in those resources is brought about through leadership and insight. And we need both of those, and I think that's the focus of this workshop today. And those of you that are here are part of that agenda, and we're extremely grateful to have the Surgeon General and his leadership in bringing that insight forward to the country in a way that it will enable so much more progress. So we're incredibly grateful to have Dr. Jerome Adams, the 20th Surgeon General of the United States, here with us today. As the nation's doctor, the Surgeon General's mission is to advance the health of the American people. And Dr. Adams' motto as Surgeon General is better health through better partnerships. Dr. Adams is committed to maintaining strong partnerships and relationships with the public health community and forging new partnerships and new relationships with non-traditional partners, including the business and law enforcement. He has pledged to lead with science, to facilitate locally led solutions to the nation's most difficult health problems, and deliver higher quality health care at lower cost through community engagement and prevention. As the Vice Admiral of the U.S. Public Health Service Commission Corps, Dr. Adams oversees the operations of the U.S. Public Health Commission Corps, which has approximately 6,500 uniformed health officers who serve in nearly 800 locations around the world to promote, protect, and advance the health and safety of our nation and the world. It's my pleasure to invite him to the podium.
Well, good morning, everyone. All right, good. That was okay. Let's try that one more time. Good morning, everyone. Good morning. Fantastic. We've got to get some energy. It's going to be a good day today. It's going to be a great day today. Thank you so much, Dr. Baase, for the kind introduction. And you know what's interesting? As we were driving in this morning from the airport, I passed a taxi cab, and it had an advertisement on the side for Wicked. Anyone seen the musical Wicked? Well, I've seen it about 5 times, and I would see it another 5 times, because every time I've seen it, you know, I get something else out of it. It's a little bit different. I love hearing how the different performers play into their roles and what they bring out. It's a different perspective. And I come here today, and there are a lot of friends here. There are a lot of people here who, quite frankly, represent the choir. And so, with apologies up front for speaking to the choir, I do think it's important that from time to time we come together, that we rehearse our songs, that we figure out how we might want to perform them differently in the future, because at the end of the day, we all need to go out and do a better job of singing to the congregation. You know, I've been lucky to get to know and to work with Cathy over the past few months. She's been critical to helping our office develop strategies and approaches to better reach new partners, to sing a different tune, and particularly those folks in the private sector. It's an honor to be here today addressing the National Academy of Sciences, Engineering, and Medicine. The fact is, you all are advocates, leaders committed to addressing the most pressing issues facing our nation and the world, and I'm proud to work alongside many of you on a day-to-day basis. And I was especially excited to accept this invitation when I saw the topic of the convening, health and the economy. Traditionally, Surgeons General, they've chosen to focus on a specific disease or issue that they take on as their signature initiative. For most of my predecessors, many of them, their work has been transformative, like what Dr. Koop did for AIDS on the heels of World AIDS Awareness Day this past Saturday. We've been thinking about Dr. Koop a lot, or what Dr. Satcher did for oral health 20 years ago. But there will never be enough time to take on all that is plaguing our communities on a disease-by-disease or risk-factor-by-risk-factor basis. So I instead chose, for me, to focus on something I felt could influence all aspects of health. And while it might seem obvious from a common sense perspective, we know that prosperous and economically stable individuals tend to be healthier. But what we're beginning to see, what we need to do a better job of articulating, is that the converse is also true. That healthier communities and individuals are, in turn, more prosperous. I chose to focus my signature Surgeon General's report on this intersection, community health and economic prosperity, or CHEP, because you can't do something in government without an acronym. But we want to compile the evidence, the data, and the best practices around community investment that not only leads to better health, but also leads to increased prosperity. The fact is in American society, we're not getting value on our healthcare dollar, and we're not investing in the actions that we know could prevent diseases and truly reduce healthcare costs. A lot of our focus is on optimizing downstream coverage, and those things are important, but I want to talk a little bit about where that metaphor came from when we talk about upstream versus downstream. The version of the story I like to tell is of a woman sitting on the edge of a stream enjoying her lunch. She noticed someone floating by, struggling to swim, about to drown. The stream was deep and it was fast, but the woman, she was a very good swimmer, so she jumped right in and saved the person. And the people on the side of the stream, they called her a hero. But another person floated by struggling, and the woman jumped in again and saved that person. This scenario played out over and over again, and the crowd grew, cheered wildly. But after multiple saves, the woman, she started to walk away. The crowd became upset. "Where are you going?" they asked. "You're such a good swimmer. Who's going to save the next person?" And I know many of you in the audience have heard some version of this story. What did the woman say? She said, "I'm going upstream to find out why so many people are falling in and how we can stop it." The fact is, much of our political debate and policy focus is on the downstream save. But upstream means those community, those social determinants of health. It's where we live. It's our opportunity to make good choices. It's recognizing that the communities we build, the innovations we make, and the care that we provide are all intrinsically connected and dependent upon each other. I'm proud to be a physician. I still practice about a day a month at Walter Reed. I will always, as long as the Lord gives me the ability to, will want to continue to provide that one-on-one interaction, because there's always going to be people who've fallen into the stream and who are struggling to swim. When someone comes in with late-stage cancer or out-of-control diabetes, we absolutely want them to get top-notch care, to be rescued from the stream. But we also know that only about 20% of our health is actually influenced by health care, and I'm being generous. Some of you all out there said it's as little as 15, 10%, even less than that. But for the sake of argument, let's call it 20%. The other 80% is mostly influenced by our environment, by our behaviors. And yet we are not investing in the health and well-being of communities, which is where most of health actually happens, and where we're going to get maximum value on the dollar in terms of improving health for all. And unfortunately, not only is our health far from where it could be and lagging behind most other comparable countries, but disparities in health status are actually widening along many metrics. Many people in many communities, far too many in our country, are being left behind and left out, even now as our economy is revving up and unemployment rates are reaching record lows. The truth is, we're not going to realize our goal of a healthier or prosperous or equitable America until we recognize and partner to address the determinants that impact the 80% in addition to the 20%. So what are those determinants of health, those factors that will give everyone an opportunity to make healthier choices? Well, they're things like housing, because your neighborhood shouldn't be hazardous to your health. Education, because everyone should have a chance to study and to lift themselves up. Jobs, because you're not going to focus on buying healthy food or getting your flu shots if you can't pay your mortgage or your electric bill. Transportation, because how are you going to get to your doctor's appointment? How are your kids going to get to the library or park if you live on the wrong side of the interstate and are cut off from services and from safe spaces? And determinants of health also include connections to the community, both emotionally and spiritually. People who are connected to a church, or who exercise together, or who are even just able to commingle in green spaces and say hello to someone as they're out getting fresh air, are healthier than those who are isolated. All of these things and more have a profound impact on a person's ability to be born healthy and to stay healthy across the lifespan, to engage in healthy behaviors and avoid conditions like heart disease, diabetes, and obesity. So this is important too. Is the Surgeon General up here pushing for a nanny state? Well, I'd say absolutely not. The embrace of an upstream approach, it does not exclude the role of personal responsibility. But I have always said the choices that people make are 100% dependent on the choices that they have in front of them. I personally can make a choice to send my kids out to run around and be physically active because I know they won't get hit by a speeding car. I know they won't get shot or confronted by drug dealers on the next block. My family can choose to eat fresh fruits and vegetables for dinner because the grocery store is closer to us than the convenience store or the fast food restaurant. And interestingly, hospitals, healthcare providers, and healthcare institutions, as well as mayors and businesses and employers, are recognizing the value of environment and community in driving health and of good health in driving economic prosperity in turn. We're in New York City. Anyone hear of this company? It's a little company called Amazon. Well, one of their headquarters is here, but another one is in Crystal City, Virginia, the big contest about where HQ2 was going to be. If you look up U.S. News and World Report's Healthy Cities, you'll see something interesting. It's no coincidence, in my opinion, that Crystal City is surrounded by 3 of the top 10 healthiest cities in America, 4 of the top 20, and the number 1 healthiest city in America is Falls Church, Virginia, which sits right next to Crystal City. We're starting to see forward-thinking communities compete for businesses based on placemaking versus simply trying to compete based on tax incentives. And you saw this play out and where the world's richest company decided to place their second headquarters. By investing in community health and some of the upstream determinants of health, we can improve the health of the population, bring unsustainable health care costs, the number 2 cost for most employers. So you ask, why do I think Amazon looked at that? Well, part of their bottom line, a major contributor to their bottom line, is the health care cost of their employees and future employees. But by addressing that, they'll better be able to ensure a prosperous future for businesses, for communities, for workers, and for all Americans. It's also important, though, to note that this doesn't just mean making healthy communities healthier. And we're seeing a lot of that go on across the country. There's a lot of work to be done in every community, make no mistake about it. But we need to make sure we're also lifting up those most in need. It means addressing the challenges in our most disadvantaged communities so that everyone has the opportunity to be healthy and to be prosperous. As many of you know, my motto is better health through better partnerships, because regardless of the problem you're trying to solve, and especially if the problem is the health of your community, it's a multifactorial problem. It's a problem that you and that we can't solve on our own. And especially when these solutions are complex, we need innovative partnerships and collaboration. We need to bring people to the table and talk to organizations we may not have worked with before. Because everyone has a stake in community health, and everyone, in turn, can contribute to making a community healthier. And forging those partnerships, and this is the key for us today, particularly for the choir out there, and breaking down those silos starts with us being better listeners. There's a saying out there that people need to know that you care before they care what you know. I'm a big fan of this concept of servant leadership. Anyone heard of that concept of servant leadership? Well, many of us have heard it, but we don't always do a great job of practicing it. Servant leadership means leading by meeting the needs of others so that their success leads to your success. As leaders within the scientific, engineering, and medical communities, you all have unique opportunities to leverage your influence and leadership to convene stakeholders and to exude servant leadership. You can forge greater partnerships that can more effectively promote the health and economic prosperity of all communities. As your Surgeon General, I'm committed to being a servant leader, to strengthening connections within the health community, and forging those new partnerships which can help us solve our most pressing health problems. You know, at my swearing in, I invited the Attorneys General, the National Association of Attorneys General, to stand next to me, and people were saying, well, why do you have them up there? They're the bad guys. They're the ones that want to lock up all the folks who are out there suffering from substance use disorder. Well, the reality is the number one provider of mental health services for people in our country is our prisons and jails. So how are we going to solve the problem of addiction of mental health if we don't invite those folks to the table? Law enforcement, academia, the military, our faith leaders, so many others. How often are you, number one, inviting them to your table, but number two, going to their table and being a servant leader, listening? Many of our current and potential partners, though, even those in healthcare, and I sit here at NYU, even those in healthcare sometimes don't realize the value of and their role in investing in true community health and the return that investment can deliver. What's population health for most physicians and care providers for a diabetic patient? It's making sure everyone gets their foot exams. It's making sure they're taking their medications. It's making sure they're on their best medication regimen. It's focusing on that 5% who are the frequent flyers, the high spenders. But what's population health for a true public health advocate? It's taking into account the 95%, taking into account the communities that they live, work, play, and pray in. It's making sure they have access to fresh foods. It's making sure that they have the ability to exercise. So again, I'd say even in the healthcare sector, even when we're talking about population health, we aren't always talking about the same things, the 80% that's upstream that truly will affect healthcare cost and bend the curve in the long run. But businesses and private sector, they're increasingly feeling the burden of poor health and realizing that they can't solve it by focusing only on the 20%. Healthcare costs are rapidly increasing and account for almost 1/5 of the U.S. economy. And this is a huge burden on families, on businesses, and on government, hampering our prosperity into the future. We have 6 million unfilled jobs in the United States. There are more unfilled jobs than there are people currently looking for work, many people having checked out because of health-related issues. Again, I say to you that we don't need to address health purely for the sake of health or the metrics that we traditionally think about. If we don't do it, our economy is going to stall, jobs are going to leave, and our country is going to suffer overall. Every dollar that goes to health care, either funded by the employer or coming out of the employee's wallet as a copay or a deductible, is a dollar that's diverted from other priorities. Priorities such as education, such as infrastructure, such as buying Christmas presents and stimulating the economy in turn. It's a dollar that doesn't go towards wage increases. You know, many folks out there in the audience today like to talk about we need to lift up the minimum wage. We need to have a mandatory minimum wage. Well, that's one way of looking at things. But if you talk to businesses, they will tell you the biggest reason wages have remained stagnant is because every new dollar that they bring in profit, part of that's having to go to offset increasing healthcare costs. So wages would go up if we could figure out how to get healthcare costs under control. Every dollar we spend on healthcare is a dollar that doesn't go towards another priority for folks, keeping our communities and country safe. So we need to help folks see that if they care about any of those things, any of those priorities, then they need to care about the health of all communities. The fact is, whenever and wherever health inequity exists, we all pay the price. Whenever anyone suffers from poor health, it's not just their concern. It should be everyone's concern. We've all got to see it as part of our mission to deliver healthier children to our schools, healthier workers to employers and businesses, and a healthier population to communities, because the science shows, and that's part of what we're here today to talk about, that people who are healthier are more productive, and communities that are healthier are economically prosperous and safer. I've seen it in East Lake, Georgia, with purpose-built communities. I've seen it in Minneapolis, Minnesota, with Blue Zones. I've seen it in Fort Worth, Texas. I've seen it with Live Well San Diego and California. And you don't have to take my word for it. You can see it here in New York City. Look at the difference in this city from the 1980s to today with the investments folks have made in health and addressing health equity. So as I bring it home, let's think about how we better engage new partners. And I want to tell you all a story. Earlier this year, I attended the U.S. Conference of Mayors in South Carolina. About 50 mayors around the table. Interestingly, the New York City mayor, Mayor de Blasio, was sitting right next to me with about 40 or 50 other mayors from around the country. And I wanted to know what made these mayors tick. I'm a doctor, so I only half-jokingly asked, mayors, how many of you all ran for office on a pledge to lower your community's hemoglobin A1C rates by 20%? How many hands do you think came up? I was shocked, not a one. Not a single hand. But the fact is, that's how we tend to engage folks. That's how we try to sell our health interventions. Those are the metrics that we tend to talk about. But the fact is, the number one issue people vote on, Democrat or Republican, black or white, rural or urban, and this was even true in our elections just a few weeks ago, is jobs in the economy. And some of you all will say, Surgeon General, I saw that health care was up there in the issues that people voted for in the last election. Well, I would contend to you that folks still aren't voting on health. They're voting on the fact that they can't pay their bills because their health care costs are so high. So it's still jobs in the economy that's driving them to lift that issue up. It's still the number one issue that people care about. Can I pay my bills? Can I meet my day-to-day needs? We need to help citizens, employers, and policymakers understand that investing in the health of the community is a driver to personal and community economic development and prosperity. That together we can make communities places where healthy workers, healthy consumers, healthy people, and healthy families thrive. And for that reason, I'm developing a Surgeon General's report that will demonstrate the link between community health and economic prosperity and provide tools for community investment that deliver health impact. Tools that healthcare, businesses, philanthropies, financial institutions, planning departments, and others can use to improve community health and to increase their prosperity. Once upon a time, folks didn't believe there was a link between smoking and health. I actually collect old medical journals, and I've got medical journals where there's doctors in white coats smoking cigarettes saying 9 out of 10 doctors prefer Camel. But then Surgeon General Luther Terry, one of my predecessors, put out a Surgeon General's report on smoking, and it ended the debate on whether or not there was a link between smoking and health. We still debate about what we should do to address it, but we no longer debate whether or not smoking is bad for your health. I hope my CHEP report will end the debate on whether or not health is tied to economic returns and instead spur action on what we all can and should do about it. I wanted to open the door for you all to have conversations and bring to bear the toolkits that you're going to discuss today during this roundtable. So as I bring my talk to an end, I'd like to leave you with a few parting thoughts. First, I want to challenge you to think about how you can promote and innovate upstream, truly upstream interventions to help our communities thrive and achieve better health through better partnerships. Second, I ask that you don't forget about partners like the faith community, the military, local businesses, and our law enforcement when you convene to discuss public health issues. They're influencers on the highest policy levels and critical touch points for the people we're trying to serve. And many of you in the audience have heard me tell this story, but I think it's a story that drives home this second point. I'm infamous, I don't say famous, I say infamous, for being the state health officer during the largest HIV outbreak related to injection drug use in the history of the United States in Scott County, Indiana, when I was the health officer there. And I get asked to come to all kinds of meetings and tell them how we solved the outbreak. And folks expect me to talk about the medical interventions that we brought to bear and all the scientific advancements that came out of it. But the fact is, the folks who were most critical to solving that outbreak were not my health partners, my traditional health partners. We couldn't have done it without them, make no mistake about it. I'm not discounting what they did, but the real obstacle we had to overcome was overcome by partnering with the faith-based community, with the business community, with the local sheriffs, with the people who really were standing in the way of us implementing the scientifically based solutions in a conservative rural community, but in turn really helped us bring forward the best practices. Again, remember what I said, people need to know that you care before they care what you know. If I'd been the state health officer sitting in Indianapolis and saying, I know better than you all, and you need to do X, Y, and Z, it wouldn't have worked. But by driving down 2 hours to that small community, by sitting with them, having a beer with them, having a conversation with them. Don't tell folks the Surgeon General just told you all I had a beer. Moderation, folks. But by sitting down and having a conversation with them, by showing them that I cared, then they cared what I had to know, and then they in turn went out and became advocates for me in the community and helped us do what it took to overcome that outbreak. So, third, think about how you can better communicate the pathway to creating prosperous communities by creating healthier communities. Don't talk about hemoglobin A1Cs. Don't talk about the things that matter to us but don't matter to other folks' priorities. Talk to your business partners who are here today. Dr. Garcia here from American Express. They aren't in their meetings talking about hemoglobin A1Cs or talking about decreases in 15% in systolic blood pressures. They're there talking about cost. They're there talking about profits. They're there talking about how can we impact our bottom line on a larger level and on a individual level. And this is critically important. I alluded to it, but remember to incorporate health equity into all that you do, because we don't want to have these great interventions that lift up the communities that are already doing well, but forget about the communities that aren't doing so well. One of the things that I really get frustrated about in terms of public health interventions is how the rich tend to get richer and the poor tend to get poorer, and we pat ourselves on the back for driving down smoking rates, but ignore the fact that disparities are increasing. We pat ourselves on the back for driving down prescribing rates, but ignore the fact that folks out there still have untreated pain and are shifting over from prescription drugs to injection drugs. We ignore those inequities that exist out there and actually, in many ways, make the problem worse for the communities that are most in need of our help. Try to ensure that the actions that you take benefit and are accessible to all communities, because anyone's poor health is everyone's concern and cost. You're a community of leaders. You're the experts in your respective fields, and you all have something to contribute to the improved health of our country. With your dedication and determination, we will overcome the various health and healthcare challenges we face today. We've got the wind in our sails. We've got folks talking about the shift from volume to value. We have the opioid epidemic, which is a terrible tragedy, but which is bringing folks to the table who previously never would have come to the table to talk about health issues. We have the opportunities, and as the nation's doctor, I stand ready to work with you to make sure we're taking advantage of those opportunities and that we stop playing whack-a-mole with disease-specific focus and talking to the same people over and over again, but instead get to a world where we really can say we've improved the overall health and health outcomes and health opportunities for all. And so I am very grateful to be here, and I talked for, I think, longer than what they expected me to, because as you all can tell, I'm passionate about this issue. But Cathy, you tell me if we have time for questions, and if not, I'm happy to engage on social media. Thank you so much, everyone.
There's supposed to be another microphone here. We are going to go ahead and take questions. If you want to come to the microphone, and please introduce yourself, and we will, I think we'll just, you want to just stand here?
We can stand here, or we can sit down and, well, actually, we probably should stand here because they're recording.
Okay. See if we can grab one of these.
All right, they're on. All right, that's great. Let's see. Any questions?
Hi, Josh Darcy from Johns Hopkins. First, I just wanted to thank you for a fantastic talk, for all the focus that you put on health broadly speaking and public health in the country, for everything you're doing, particularly the opioid epidemic, which I think is having a tremendous impact.
Thank you.
There you go. Well, for the record, thank you for your great talk and everything you're doing around the country on public health and the opioid epidemic. I have a question, though, on a difficult topic that relates to both health and the environment, and that's immigration. Because I think that there are a number of current immigration policies that are profoundly damaging health in many parts of the country. We have kids, parents being snatched, by immigration right outside of school in Baltimore. We have a proposal that would push immigrant families off of Medicaid, housing assistance, other things that are essential for children to be successful in life. And there's also evidence that immigration really helps fill the gap in jobs that you talked about. So how do you see a constructive discussion on immigration part in an overall approach to health and the economy?
I think that's a great question, and I think it's a fair question. I think one of the challenges is trying to figure out, with our 6 million unfilled jobs in this country, how we take advantage of folks out there who want jobs and are willing to engage and to work. I think that we need to, again, do a better job of communicating that aspect of things and helping folks understand that there is a net benefit to making sure we have a reasonable immigration system at play in this country. If it were easy, we'd have it solved. It's a challenging situation, and again, I like stories. I live in Northern Virginia. There's a case in Northern Virginia of an individual who came into the country and was let go in a catch-and-release fashion, and then went on to murder a student in the school there. And I just tell you that story because one of the challenges is one bad story can change the public perception for millions of people out there. And so our job as public health advocates is to try to paint a picture where folks understand not just some of the terrible difficulties that folks outside of our country face, but also the advantages and the benefits of a reasonable pathway for bringing those folks into the country. And I encourage everyone, if I don't have the answer. Again, if it were easy, then we'd have it solved. But I encourage all of you all to be at the table, to not demonize the other side. And folks will get mad at me for this, but I've always tried to be the convener, the mediator in the room, and tried to understand both sides and tried to say, how can we lay out a pathway forward? And so I know you all are doing that at Johns Hopkins. I would encourage you to continue. I lived on the border. I lived in Laredo, Texas. I've seen the challenges that exist down there, and to recognize that the situation is very different in New York City than what it is in Laredo, Texas, and that we, as experts, need to be willing to convene and to hear both sides out and to again, paint a pathway forward for folks. So thank you for that softball question and to start things off, Josh.
Okay, John.
Good morning, John Auerbach from Trust for America's Health. And again, thank you very much, Surgeon General, for your incredible leadership. I wanted to ask a question about obesity, a topic we've focused a lot of attention on in the last decade, and a lot of work has been done on this. And yet, the latest data that we've received, both in terms of adult obesity and child obesity rates, show that we're still getting higher levels each year. We haven't really turned the corner yet. And so, a lot of us are reflecting on, we've done a lot, and yet it's not yet seeming to have the results that we wanted, and that, results in increased diabetes cases, other health problems. Do you have any thoughts about what can we do differently? Is it more of what we've tried already? Do we need to try some new strategies? How do we grapple with this issue?
I think it's a great question, and it is a tremendous challenge. I think there are two things that we can do to better address the issue. Number one is many folks see obesity as a personal responsibility issue, just in their own mindsets. Choose not to eat the cheesecake. Choose not to get the big gulp. Choose to go out and exercise. We need to do, again, a better job, and this is the whole point of the CHEP report, of helping everyone first understand that your environment, the choices that exist around you, have a profound impact on the individual decisions you make, including what you choose to eat and whether or not you choose to go out and be physically active, and that we can do things across the board that have a control, that affect that environment, that give people better choices, and that, again, if we encourage them, if we nudge them to make those better choices, then it's going to have an impact on the things that we all care about. That, John, if you choose to go overboard at Thanksgiving, well, we don't want to get on Thanksgiving. I love Thanksgiving, the holidays. If you choose to go out and eat something bad afterwards, that it's not just you, that it impacts me, and that I can do things to affect your choice. So I think that is a big part of it, that we've got to move beyond the personal responsibility mindset, and that's what we can do to help educate folks. I think the other thing, and this is interesting when you look at blue zones. Blue zones found that the communities of folks who lived the longest, they had social connections. They had abilities to go out and walk and to exercise together. And if you really look at those communities, the things that they were doing to stay physically active, they weren't really looking at them as opportunities to exercise. They were opportunities to socialize. And the more that we can create an environment that allows folks to be physically active without making them feel like they've got to go into a gym and pump iron in order to do so, that they've got to carve it out of their day, but that it's incorporated into their lifestyle, the more we'll be able to create an environment that turns around this obesity trend. And if you look back historically, I personally think that's why the obesity rates have continued to go up. We've shifted from a society where physical activity is incorporated into our life throughout the day to more of a society where physical activity is that 45 minutes that you spend in the gym. And the rest of it, we're not thinking about walking or biking or doing the things that ultimately will have a bigger impact on our ability to stay at a healthy weight than even going to the gym every day for 45 minutes.
Well, in the interest of time, I'm going to have to cut off questions now, and appreciate so much your attention, and just really thank you for being here. What a great way to kick off our day, and focusing on a new way of thinking about the science and the messaging and the relationships with all the partners we're going to need to continue to move the focus of resources based on true insight about the linkage between health and the economy.
Thank you so much. Thank you for what you do. We really do. I mean, I said it, but it bears repeating. You have an opportunity right now. Folks want your expertise. Healthcare institutions are trying to figure out how to shift from volume to value. Folks are willing to come together to talk about tough health issues. Number one, because of the opioid epidemic. Number two, because healthcare costs are the number two cost for most Fortune 500 companies and are limiting their profitability and limiting their ability to be able to attract and retain a healthy workforce. So as depressing as some of these numbers are, I'm optimistic about the opportunity that exists. I'm optimistic because of all of you in this room and who are listening on the webcast who are committed to this issue. And I'm convinced that 10 years from now, we're going to look back and see this as the time when we turn things around, when we finally did start to recognize and be able to articulate the value of overall health and of health equity. So thanks for the opportunity.